let me give an example for family medicine, perhaps, right? So that you can give an example that, hey, this happened to me, this happened to myself when I was in such a situation, and that's how I dealt with it. So most of your questions, if you answer with an example, that's usually a better deal, because they will say, okay, yeah, they're just not speaking it. They probably went through it, and they will realize that this situation is definitely valid. So let's give an example of a family medicine, since a lot of people have family medicine interviews. Okay, so okay. So I do see that constructive criticism definitely has a lot of value, and it is a valuable tool for my own growth. And I've known this, I have learned this from my experience. And especially in family medicine, I do believe that, criticism is important, and patient communication is key. And once when I was in my outpatient family medicine clinic rotation, my attending did provide me some feedback that I needed to improve my preventative care counseling skills better, particularly when I am discussing lifestyle changes with my patients. And I realized that, yes, my approach was a little too technical, and I was not meeting the patient where the patient was, mentally at least. So I asked for specific suggestions on how to communicate more effectively, and he gave me an example. And by implementing some of these changes, I realized that I have to be a bit more simpler in my language and more motivational in my interactions with my patients. And I did see a significant improvement from my very next patient, and I have worked on that. And this is how I deal with criticism. I look to see, yeah, that seems as a valid piece of feedback, and yeah, and I take it in, and I improve upon myself. And I am at that stage that I have to take feedback. I'm just learning. I'm at a very beginner stage right now, but yes, that's what I've learned so far. Thank you so much. Okay, so scenarios, internal medicine, you can do different scenarios. Psych will have their own scenarios. So hope this should be the approach. Even if you memorize answers, try to be a bit more casual. Try to not sound robotic. Make it seem casual. All right. Okay.